Hey guys, we're gonna start with pathology. In the next few videos, I'm gonna put up some pathology videos. I'm gonna be going according to system, like gastrointestinal, cardiovascular, respiratory. So I'm gonna go according to systems. So first, we're going through gastrointestinal pathology. It would be quite a lot easy if you would go through the gastrointestinal physiology first and then go through pathology, but whatever is okay with you. And I'm gonna be taking these lectures according to the parts, like a particular small video for all the diseases which occur in the esophagus, another video for the diseases which occur specifically in the stomach, the ones which occur in the large and the small intestine, liver. I'm gonna go for different videos so it's easier for you all to kind of go through the videos quickly instead of a 130 or 45-minute long video. It's better to go on through the small videos. So we start on with the diseases of the esophagus. Let me start. Just a sec. Yeah. So we go on through the first part of the GI tract. That's the esophagus. Just a little bit of pathology here and a little few facts which can be asked in the exam. It's a tube, muscular tube extending from the oral cavity to the stomach. It's got three regions, and those three regions are histologically differentiated by the muscularis layer. The muscular layer. It's not the same from the oral cavity to the stomach. It's different. The upper third, the uppermost part that is close to the oral cavity, it consists of voluntary muscles that help in swallowing and everything. The middle part has got voluntary and smooth, both muscles, and the lowermost part has got smooth muscles only. The part which is closer to the stomach. So the way to remember this, if you cannot just remember these lines, is that if you imagine the oral cavity, you chew by yourself. That's a voluntary action. So the part near the oral cavity is gonna have voluntary muscles, and the part near the stomach, it's gonna have smooth muscles because you have no control. You don't have any voluntary control over your stomach. So kind of remember like that smooth muscles, they don't have, they're involuntary muscles. So the part closer to the stomach is gonna be made of smooth muscles. So this is asked quite a lot of times, so just remember this. Okay, we go with the congenital malformations occurring in the esophagus first. The most common and the most prevalent one is tracheoesophageal fistula. Now, what is a fistula? A fistula is an abnormal connection between two parts of the body which were not supposed to be connected. So, as the name suggests, tracheoesophageal. That means there's an abnormal connection between the trachea and the esophagus. Normally, those two tubes are not connected. I mean, you wouldn't want them to be connected because the food you eat, it shouldn't go into the lung, you know. So, this is an abnormal condition. So normally, how it presents. Let me just put on the next slide where you can see the figure. Yeah, so it presents like this. The upper portion, it kind of forms like a blind pouch, an unending, like just abruptly ends somewhere, and the lower part of the esophagus gets connected to the trachea like this. So this is what tracheoesophageal fistula is gonna be. This is normally congenital. The baby is born with it, and as soon as the baby is born, he has to undergo intensive surgery to get it cleared off. And this is not quite asked a lot, but if you get a question like what syndrome is associated with, it's tracheoesophageal fistula is associated with which of the following syndromes? It's going to be Vater syndrome, VATER. V is for vertebral defect, A for anal atresia, TE for tracheoesophageal fistula, and R for renal dysplasia. Now, what is atresia? Anal atresia is normally there's a hole to pass the feces and everything out. So, in the case of anal atresia, there's an overlying skin over it, so there's no hole. It's, you can see from the figure, there's no hole to pass the stools out. So this also has to be made surgically as soon as the baby is born. Then another congenital malformation is esophageal stenosis. It can be congenital. It can be due to inflammatory conditions. It can be due to trauma. If someone just kind of, you know, um, you excuse me, someone kind of hits you on the throat, or someone try to kind of kill you by just grabbing your throat, then those are the traumatic conditions in which you can get esophageal stenosis. We go into inflammatory disorders. The first and the most common one is esophagitis. That is, you put itis behind anything, it's going to be inflammation of that organ. So esophagitis is inflammation of the esophagus. Mostly involves the lower half of the esophagus. There's a typical presentation the patients are going to have. They're going to put their hand on the chest and they're going to be like, "Doctor, I've got heartburn." Why is it called heartburn? Because it is the substernal, the area of the esophagus right behind the sternum. In that area, the esophagitis is gonna occur, so it's gonna be like a burning sensation. So, and the heart is also located in that area, so patients always complain of a typical word by using the typical word that I have heartburn. So heartburn is nothing, but it's one of the symptom of esophagitis. Then there's regurgitation. Regurgitation is coming up of the acidic fluid and everything from the stomach up into the esophagus. So what's gonna happen is it's gonna burn the esophagus and make the condition even more worse. There's going to be dysphagia. Dysphagia means inability to eat. You can get this question, what is the meaning of dysphagia? So it's going to be the inability to eat. Of course, if there's burning sensation and everything is messed up in your esophagus, it's going to be difficult for you to swallow something. It's going to be hematemesis. Hemat meaning blood, emesis meaning vomit. So it's going to be bloody vomit, because whenever the person vomits, it's gonna erode the skin which is inflamed, erode the epithelium of the esophagus that is inflamed, and that's gonna cause bruising, and that's gonna cause bleeding. So hematemesis. Now, this condition can predispose to esophageal cancer. Any chronic condition in the body, any chronic irritation in the body is gonna predispose to cancer, whether it be in the esophagus or in the oral cavity in the form of a sharp tooth which constantly irritates the mucosa. That can also turn into cancer. So that is one of the features of chronic irritation. It can become cancerous. So the causes can be hot liquids. You drink something very hot, it's gonna cause temporarily for 2 3 days. It's gonna burn your esophagus and cause you problems. Alcohol itself. Now, I don't want to disclose anything here, but yeah, if anyone who's taken tequila or whiskey shots, all type of hard alcohols are a little bit warm to the esophagus. So you can remember it that way. Alcohol is gonna be warm, or it kind of feels hot in the throat, so it's gonna cause esophagitis if it's a chronic alcoholic person. Smoking, of course, it's gonna burn the mucosa. Um, Infections with herpes or cytomegalovirus or candida can also cause esophagitis. Complications, we already said it can turn into cancer. The most common type is the squamous cell carcinoma. But before cancer happens, we can see ulcerations, and the ulcers are going to bleed, so that's going to cause bleeding. And bleeding is going to lead to anemia. So this is kind of like a chain going on. Inflamed the tissue is going to ulcerate, ulcerations, there's going to be bleeding, and bleeding because of that, there's going to be anemia. So it's a vicious cycle going on. Another common type, it's not actually common, it's rare, but this is very common in the test. That's Barrett's esophagus. It's nothing but metaplasia of the esophagus lining. Normally, there's squamous epithelium in the esophagus, but it is replaced by columnar epithelium. And columnar epithelium is present in the stomach lining and the intestine lining. So it's called gastric or intestinal columnar epithelium. This one also is there are very very high chances of this to get converted into an adenocarcinoma. Tumors which occur in the esophagus, benign tumors are normally rare. They're always carcinoma. So it occurs after 50 years of age. Etiologies, again, all those etiologies which cause esophagitis. They can be that smoking, alcohol. Smoking and alcohol are probably they're like the etiology of so many types of cancers. So smoking, alcohol, Barrett's esophagus, vitamin A deficiency. Now, what is going to happen if you have a vitamin A deficiency? Vitamin A, normally the main function of it is to maintain the epithelium of the body. So if you have a deficiency of vitamin A, the epithelium is not going to be maintained properly. There's going to be inflammation and everything. So once the tissue is inflamed, there's chronic irritation in that tissue, and that can get converted into carcinoma. So vitamin A deficiency is responsible for that. And there's another thing called Plummer-Vinson syndrome. I think we have it in the next slide. Yeah, Plummer-Vinson syndrome we'll see in the next slide. Most of the esophageal cancers are squamous cell carcinomas. These can be asked in the questions in the test. Most of the esophageal cancers are squamous cell carcinomas. They have a very poor prognosis, and they can even ask you a question, where does it metastasize to? So it goes to the liver and to the lung. Some miscellaneous ones. Plummer-Vinson syndrome it's actually a triad of esophageal webs, which causes dysphagia, atrophic glossitis, and iron deficiency anemia. So this one also predisposes to adenocarcinoma. This one is also asked many times. Like they can ask you a question like the syndrome associated with iron deficiency anemia is dash. So it's going to be Plummer-Vinson syndrome. Going to the next one is this is a rare one, and I don't think they ask much, but it's just to remember if you can. They're called as the Mallory-Weiss tears. Now, what happens is when the patient, due to some condition, has forceful recurrent vomiting, he constantly vomits. And one of those conditions is bulimia, where the patient constantly vomits. What's going to happen is at the junction of where the esophagus meets the stomach, at that junction there's going to be tears. The mucosa is going to tear at that point. So because of that, there's going to be bleeding and other symptoms. It's not much of a big deal, but yeah, they're known as Mallory-Weiss tears. And another one, the last one, is the esophageal varices. Very common, probably everyone would be knowing, is most commonly associated with cirrhosis of the liver and portal hypertension. Now, you don't need to go much into detail about portal hypertension. Now, how actually, let me just tell it to you in quickly. Now, what does happen is when there's cirrhosis of the liver is going to become fibrosed, and the heart will have a difficult time to pump blood to such a hard consistency liver. So that's going to cause portal hypertension, and because of that there's going to be hypertension in the vessels which supply to the lungs and the esophagus. So the vessels of the esophageal venous plexus, they're going to be dilated because of hypertension. So, and they're going to be dilated. So what happens is they're going to come up on the surface of the mucosa. So they can easily be prone to bleeding due to ulceration or minor bruising. And this can be life threatening in some conditions if a major artery or a vessel or vein, it kind of it gets nicked into the esophagus, then it can cause massive bleeding and the patient can die. So it's a life-threatening condition. So this was all about the diseases of the esophagus. I think you don't need to know anything more about these. Any other diseases, these are more than enough for the diseases of the esophagus. Hope you liked the video. Do like, share, comment, and subscribe to my channel. The next video is going to be about the disorders of the stomach, and then we move on to large intestine and various other parts of the GI tract. So stay tuned for the next video.